Hi, Ann.
Hi.
My name is Jen, and we're going to walk through how to set up a nebulizer treatment for a resident, okay? The first thing we want to do, of course, always is wash our hands and put on our gloves, and I've seen you've done that.
Yes.
And did you do your 7 rites of medication?
I did.
Fantastic. So then I think we're ready to go. So we're going to tell the resident, of course, what we're doing, get them into a comfortable position. And then we're going to start putting our equipment together. So go ahead and plug in the tubing into the machine. And sometimes the port isn't always on the top. Sometimes it's on the side, so you just might have to, look around different machines. We always try and use this machine, but you never know sometimes what you're going to get. So next we're going to assemble these pieces here, okay?
Okay.
So I first find the base piece that needs to be plugged into the other end of that, and I attach that right away. Yeah. And then in every nebulizer cup, we need a little filter piece that actually creates the mist, and that's it. Fantastic. Now at this point, I would put the medication in, squeeze all of the medication in. There you go. And then we can put the top piece on. And then we're going to put the T connector on. It literally looks like a T. The T goes on top. And then both of these pieces go on either end, and sometimes it's like a puzzle. You just got to figure out which one fits in which end. Correct. You always want to make sure that the mouthpiece is horizontal. Turn it vertically. That wouldn't be comfortable, would it?
No.
So we always want to make sure that it's horizontal, all right, and that the resident will be comfortable using it. Then we're going to turn on the machine and make sure that it's working. Yes, you should see mist coming out of the exhaust end. That's kind of what we call the exhaust end, and then the mouthpiece end, and we know it's working. Hand it to your resident and instruct them to hold that. You might want to ask them if they want to watch TV while they're getting this treatment. You will need to stay in the room while the resident is receiving the treatment. It lasts about 10-15 minutes, and then at the end you'll kind of hear some trickles, and it'll start to not mist anymore, and then you know it's done. At that point, we're going to take it apart.
When would I use this?
Good question. Yes, some of our residents need to use a mask because they forget. So they might be holding, this kind of medication and put it down, but their treatment isn't done yet. So some of our residents do use masks, like those in memory care. So yes, you just place the mask right on the top, like that.
Oh, okay.
Fantastic, yeah. And then you would put that on their face and then put the strap kind of around their head to hold it in there. All right, then you can take the pieces apart. We're going to wash them in warm soapy water. We're going to rinse them, and then we're going to put them on a paper towel to dry. All right? The only piece you don't need to wash is this long tube. You might want to wipe it down with an alcohol tube, but we don't actually put it in the sink with these pieces. All right? Then when we're done, we're going to take off our gloves, we're going to wash our hands, and we're going to document what we did.
Great.